So any therapy has a potential risk of the family or the individual not meshing well with that therapist. And then you've created a really negative experience between a provider and a family or an individual. And so that's a risk really with any particular therapy, is that if you find somebody that just doesn't work well with you, then it kind of puts you off and it doesn't make you want to go seek another therapist. In terms of a speech language pathologist or an occupational therapist, or even a dietitian or a counselor that's working on more anxiety, if you find that that particular provider is setting goals that are too aggressive, that can be hard for the family, especially when working with a child, that maybe you're pushing that child too quickly. And that's going to in turn create more behavioral issues, because children, certainly, if they're not ready to progress to meet developmental milestones, if they're not ready to have a certain texture of food in their mouth, they are just going to shut down, and it is going to end up creating more behavioral problems, and you're going to end up making the problem worse than when you started with. So the most important thing is to make sure that you find a therapist that works well with your family, that has the same goals as your family, if you're an adult, that has the same goals that you have. So when you find the therapist, it's important at the beginning, before you begin any treatment sessions, to discuss what, as a family, as a patient, what are your goals? What do you want to do? How quickly does that therapist like to try to reach goals? How often does the therapist want to meet to have therapy sessions? What signals does an adult patient or does a child have to give a therapist so that the therapist knows when to stop therapy for that day, so that you can make sure that therapy is always a positive experience. So that's really one of the biggest risks, is making sure that that therapy is a positive experience, and when it's not, that's when you're going to have more behavioral issues.